Hello, Dr. Leiter. I'll be doing my presentation on Parkinson's disease today. Just as a little background, we're kind of working with what we have. The slides might stick a little bit, but it's because I'm controlling the slides from my iPhone, which is synced to my TV. So if it sticks a little bit, I'm sorry. Not meaning to, just working with what we have. So I'm going to get started. As I mentioned a few seconds ago, my PowerPoint is on Parkinson's disease, or PD as it's going to be referred to in this PowerPoint presentation. So some notable stars with Parkinson's disease are Michael J. Fox, Muhammad Ali, John Cash, Charles Schultz, who created the Peanuts comic strips, and Brian Grant, who played for multiple NBA teams, and Estelle Getty from the Golden Girls. What is Parkinson's disease? Parkinson's is a chronic nervous system disease marked by tremors, muscular rigidity, and slow, imprecise movements. It involves the death and malfunction of neurons in the area of the brain called the substantia nigra, which is one of the movement control centers of the brain. Cells in this area release a chemical neurotransmitter called dopamine, which is responsible for movement and balance in a person. As this area degenerates in people with PD, the dopamine level decreases, thus creating movement problems and difficulties for that person. This is a table that I found. It's called the Hoehn and Yahr scale, and it basically goes through the 5 different stages of Parkinson's disease and the severity of each stage. So as you can see, in stage 0, there's no signs of PD at all. And if you go down the list, you go to 5, you can see that assistance is greatly needed. You may be needing to be in a wheelchair and may be bedridden and have to be assisted with activities of daily life on a daily basis. So I found this chart to be very interesting when researching. Some of the signs and symptoms of Parkinson's disease are tremors, which is the shaking of a limb. Usually starts in the hand or fingers, very small. Some with PD rub their thumb and forefinger like this, and that's actually called a pill rolling tremor, which I was unaware of until I started doing research. Bradykinesia is one of the other symptoms in which movements become slower and more difficult. Some examples of this is having a lot smaller stride length and having fewer in stride frequency when you walk. So your gait can be compromised with PD. Rigid muscles, stiff muscles may occur in any part of the body, limiting the range of motion in that part of the body. Impaired posture and or balance. Posture may become stooped, so something kind of like this, and balance may start to suffer. Loss of automatic movements, so movements such as blinking, smiling, and gesturing when talking to someone may be compromised. So one of the signs that some look at as having PD is having no real facial expressions anymore. And also speech changes. You may speak softly or very fast, or you might slur your words together. One with PD may also speak with more of a monotone voice. How is PD diagnosed? Most diagnoses of PD are first made by a physician through a look at the person's neurological history and an assessment of the person. Examples of the assessments that a physician might go through when trying to figure out if someone has PD would be checking for animated expressions on a person's face, which I mentioned with the loss of facial gestures. Observing limbs for tremors, checking for stiffness in limbs, difficulty of doing various activities of daily living, observing gait while walking. That would be in the previous slide when I mentioned with the decrease in stride length and stride frequency. If there's a change in the speed of the gait, that would be something to look at. Balance assessments. There are other tests that can be done, such as brain scanning, which can measure dopamine levels. And as you know, dopamine is one of the main neurotransmitters of movement and balance. This mode of testing is very expensive and needs to be done at specialized imaging centers, which is why it's not really too common to do. But for the most part, Parkinson's disease is kind of, it can't really be pre-diagnosed. You can't say you have pre-Parkinson's disease. By the time you start showing symptoms of Parkinson's disease, you have it. And it's unfortunate, and there are researchers working on figuring out how they can possibly figure out before it starts to happen, but it's really more genetic than anything. So aside from getting diagnosed, there are some medications that can help at least subside some of the symptoms of PD or help keep them under somewhat control. And some of those medications are carbidopa and levodopa, which is used to treat muscle stiffness, spasms, tremors, and insufficient muscle control caused by PD. So it basically deals with some of the symptoms of Parkinson's disease and keeps them under control. Dopamine agonists, apoikin and bromocriptin are used to stimulate the areas of the brain that are influenced by dopamine. So basically the brain thinks that it's getting the adequate dopamine level. So you're trying to trick the brain into thinking that it has the appropriate amount of dopamine, even though it doesn't. Anticholinergics are used to reduce the tremors. So that's really more focused on the tremor aspect of Parkinson's disease, the various shaking and trembling that can happen when you have PD. MAOB and COMT inhibitors inhibit the enzymes in the brain and prolong the effects of carbidopa and levodopa, because like all medications, at some point the medications wear off. Well, what this last group of medications does is it sort of prolongs the positive effects of the carbidopa and the levodopa so that it lasts a little bit longer. It blocks those enzymes that would otherwise start to decrease the effect of the first medications. Sorry, Dr. Leiter, working with what I got. Exercise testing for individuals with Parkinson's. Balance, gait, mobility, range of motion, flexibility, and muscular strength tests are recommended before any exercise tests are done. Also, an individual's fall history should be looked at. Manual muscle testing, the arm curl test, dynamometers, and chair rise tests can be used for strength evaluation. Flexibility can be measured using a gonio, a sit and reach test, or the back scratch test. To test cardiorespiratory function, the 6-minute walk test can be utilized. To measure functional mobility, the get up and go test chair sit to stand can be used. Safety must be a priority, and one must take into account balance difficulties and physical limitations when working with someone with PD. So essentially, a lot of what goes into exercise prescription for people with PD is doing ADLs, or activities of daily living, and figuring out which exercises can most greatly mimic those ADLs that you can do, so that life can be as normal and as normally functional as possible. Okay, so this is fit recommendations for individuals with Parkinson's based on aerobic exercise. These are recommendations for people with Parkinson's disease. The frequency is 3 days per week. Intensity is 40% to less than 60% of VO2 reserve, or rate of perceived exertion of 11 to 13 on a scale of 6 to 20. The time per exercise bout or session should be 30 minutes of continuous or accumulated exercise, which basically means you could do 3 10-minute bouts a day in those 3 days per week. Types of activities could be like a recumbent bike or arm ergometer for individuals who have very severe PD, where some of the normal function of the body is compromised. Okay. These are fit recommendations, and all of the fit recommendations come from ACSM's exercise, fitness, exercise, and prescription book. So this is fit recommendations for individuals with Parkinson's disease in relation to resistance exercises. Frequency is 2 to 3 days per week. Intensity is 40 to 50% of one rep max for individuals with PD, beginning to improve strength. 60 to 70% 1 rep max for advanced exercisers. Time, greater than or equal to 1 set of 8 to 12 repetitions. 10 to 15 repetitions for adults starting an exercise program, because you want to build up that endurance in the muscle, the muscular endurance. Emphasize extensor muscles of the trunk and hip to prevent faulty posture, and on all major muscles of the lower extremities to maintain mobility. Obviously, the trunk is extremely important in like I said, maintaining that posture, trying to have as normal functional bodily movements as possible. Okay, these are fit recommendations for individuals with Parkinson's disease as it relates to flexibility exercises. Frequency is 1 to 7 days per week. Intensity is full extension, flexion, and rotation, or stretch to the point of slight discomfort, mild discomfort. You never want to actually hurt. If it starts to hurt, you need to reevaluate the stretches that you're doing. Definitely. Time, perform flexibility exercises for each major muscle tendon unit. Hold stretches for 10 to 30 seconds. Now that might be hard for somebody with Parkinson's disease, so you just kind of want to go somewhere between 10 to 30 seconds. If you're not quite there yet, don't worry about it. You will get better. Type, slow static stretches for all major muscle groups should be performed. Flexibility and range of motion exercises should be emphasized for the upper extremities and the trunk, as well as all major joints in all stages of PD. So it doesn't matter if you're at stage 1 of PD or at stage 5, you should be doing some type of flexibility exercises, some type of stretching, just to, like I said, and I'm going to keep repeating this because it's very important, to try and maintain some level of normal range of motion and normal bodily function and movement. Spinal mobility and axial rotation exercises are also recommended for all stages of PD. Neck flexibility exercises should be utilized to decrease rigidity that is correlated with posture, gait, balance, and functional mobility. All right. This was also from ACSM's fitness and exercise prescription book. These are recommendations for neuromotor exercise for individuals with PD. Balance training is a vital part of an exercise program for individuals with PD. Obviously, risk of falling, gait, these all relate to balance. And if you can have better balance by training balance, then you can have a greater chance of living sort of a quote-unquote normal life. So some examples of balance training activities would be stepping in all directions. So something as simple as stepping forward, stepping backward, stepping to the left, stepping to the right. For someone, excuse me, Dr. Leiter, itch in my eye. Sorry about that. Something like that to someone who doesn't have PD may seem very simple, but like I said in the beginning, with the stride length being compromised, the stride frequency being compromised, someone with PD being able to step in all directions would be a huge accomplishment. Stepping up and stepping down, so having maybe a little step here, or depending on how intense you can go, if you have PD, you can increase the height of the step or include multiple steps. Walking with an exaggerated stride length. Now this is something that someone with PD would have to really work on, especially in the later stages of PD. And to be honest, this may not be a total possibility for someone who would be at stage 5 of PD. Stand up, sit down. Obviously we all get up out of chairs. We all sit in chairs. So this is an ADL, and this would be an ADL exercise. And this would be something where if you improve strength, flexibility, core strength, this exercise, if someone with PD maybe was really kind of slow in their movement in doing this in the beginning, went through a training program, you might see some real improvements in their just standing up and sitting down. Tai Chi. Now, from what I know about Tai Chi, it's all about really slow and controlled movements of the body. You really want to just have that control. And control is a very hard thing for people with PD to grasp, like I said, especially in the latter stages. So Tai Chi would really benefit someone with Parkinson's disease. Also, dance is very, very good for people with Parkinson's disease. It's a very good exercise for people with Parkinson's disease, especially the tango and the waltz, which I will actually get into more depth on why those are beneficial and how research has been done to show that a little bit later in the PowerPoint. All right, some special considerations to think of are to incorporate functional exercises to improve neuromotor control, balance, and maintenance of ADLs. Like I said, be careful of medications that may provoke an exercise response that is unpredictable. So please, before you start training somebody with PD, please get a health history form, a PAR-Q, know what they're taking as far as medications go, because like it says in the PowerPoint, some medications can have undesirable effects when paired with exercise and strenuous activity. Carefully monitor heart rate and blood pressure during exercise due to the fact that most with PD suffer from autonomic nervous system dysfunction. So like I said, blinking, smiling, how the heart works can be compromised with people with PD. So this is another crucial point of emphasis to have in your mind as you're training somebody with PD. Cognitive decline and dementia may burden the training and progression of a program. You would just have to work with somebody through that with PD. You need to emphasize fall prevention and education and implement it into the exercise program. One of the biggest injuries that can happen with people with PD is falling. And that's basically due to poor gait, balance, and control of the body. Sorry, Dr. Leiter. Like I said, going from the phone. Sorry. Avoid using a multitask method during training, as it may be difficult for an individual with PD to focus on more than one task. This is very true. People with PD have a hard enough time just going through one movement pattern. To compound the movement patterns together would be a real challenge, would be very difficult, and someone with PD may get very frustrated and may just want to give up. So this is definitely another kind of star task that you should be thinking of as you're training somebody with PD. Pay close attention to fatigue in an individual with PD. Obviously that's important with anybody that you train, to pay attention to fatigue, because the last thing you want to do is increase the risk of injury and increase the risk of something even more fatal happening. So exercise programs for Parkinson's disease. Research has shown that individuals with Parkinson's disease can greatly benefit from exercise. Some of the benefits of exercise include decreased muscle stiffness, improvements in mobility, improvements in balance, improvements in posture, improvements in gait for walking and running. It may also reduce depression in individuals with PD. So it may give somebody with PD a greater sense of accomplishment with all that they have to go through with PD. So I decided to focus on one aspect of exercise that you can do with individuals with PD, and I found that dancing was one of the most beneficial exercise programs that you can actually do with somebody that has Parkinson's, based on some of the research that I gathered for this PowerPoint. So those with PD have issues with gait and balance that can lead to falls and accidents, which I've gone over several times throughout the course of the PowerPoint. The 4 key areas to help improve gait and balance are cueing strategies to improve gait, cognitive movement cueing strategies to improve gait, cognitive movement strategies to improve transfers, perform exercises to improve balance, and train joint mobility and muscular power. So this is some of the research that I did on dance for people with Parkinson's disease and how and why it's so beneficial. Dancing as a form of exercise for those with PD covers the 4 keys that were mentioned in the previous slide. It uses external cues through music to learn and execute the various dances. It also teaches various movement techniques. Balance also comes into play when dancing. And finally, dancing can be a great cardiovascular workout. Okay, this is the research that I did. Several studies were done on the relationship of dance to improve function in people with PD. One of the first studies compared a 6-week period of dance therapy to a traditional exercise program. And it was determined that the dance group showed improvement in movement initiation, while the exercise group showed no significant improvements. Another study was done to examine the effects of the tango on functional mobility in individuals with PD versus the traditional exercise program. The research showed huge improvements in balance, which included a 4-point improvement on the Berg balance scale, with a 2 times a week, 10-week tango program or dance session. There was also significantly more engagement and interest in the tango class than the exercise program. Now, mind you, this is all these studies were done with people with Parkinson's disease. So it was kind of like 2 test groups. Okay. And then this was another study that was done. This is a graph depicting some of the changes that happened on the Berg balance score with this study and the 6-minute walk distance test. So basically a comparison of the tango, waltz, foxtrot, and tai chi were done. All 3 forms of dance showed significant improvement in the Berg balance score and in the 6-minute walk for distance travel. Berg scale scores increased by an average of 4 points. Distance in the 6-minute walk improved by an average of 4 meters, which you can see here. Also, backwards velocity and stride length showed great improvements. And this was just kind of a fun slide that I wanted to sort of wrap this PowerPoint up with. I found this on Michael J. Fox's Parkinson's website. I believe it's michaeljfoxparkinsons.org. So it just kind of goes through a little bit of fun facts. Well, not fun facts, but facts about Parkinson's disease. 1 million in the U.S. and 5 million in the world are living with PD, Parkinson's disease. Parkinson's disease affects 1 in 100 people over age 60 in the United States, and 60,000 new cases will be diagnosed this year alone. Parkinson's does usually affect those that are older in population. There are cases where Parkinson's can develop as early as age in late 30s, early 40s, as evidenced with Michael J. Fox. 3 out of 5 Americans will suffer from a nervous system disease such as Parkinson's or Alzheimer's. Lesser known symptoms of Parkinson's disease include depression, apathy, fatigue, and dementia. Researchers are investigating potential early symptoms such as impaired sense of smell, certain sleep disorders, constipation, and unusual fatigue. The best Parkinson's drug was discovered in 1967, which is actually the levodopa. Parkinson's disease is caused by the death of dopamine cells, which I mentioned earlier. One of the things I'd like to bring up in here is the exact cause of Parkinson's, unfortunately, is still unknown. There's a lot of mystery to what actually causes Parkinson's disease, and the consensus right now is that it is hereditary and that it is something that is passed down from generation to generation. There is no test to truly diagnose Parkinson's disease, and sometimes you have to wait years to actually finally know that you have it based on the symptoms that you're showing. One thing I will mention that is not in this PowerPoint is some of the research that I did showed that they are trying to come up with technology and electrodes that can be implemented in the brain to sort of once again mimic those dopamine levels while actually not being there, but doing it on more of a full-time basis where the individual with Parkinson's can actually has the power to control the electrodes and how strong they are. But that technology is still being put through the ringer at this moment. It is not out on the market yet, but hopefully soon it will be. For more information on the things that I've touched on here regarding Parkinson's, you can go to michaeljfox.org. You can go to pf.org. I found a wonderful Instagram of somebody who has been living with Parkinson's for some time now, and he basically diagnoses 30 days with Parkinson's and some of the daily struggles that he goes through, and diagnoses them or gives information about them through pictures on Instagram with captions. So if you'd like kind of an inside look in depth as to what someone with Parkinson's goes through on a daily basis and how it changes from day to day, that would be a great thing to look into. Another website is parkinsonhope.org. You can go to nsca.com, acsm.com, ACSM's Guideline for Exercise Testing and Prescription book, and NSCA's Essentials of Personal Training. I just wanted to kind of end with this quote. Sorry, Dr. Leiter. I just wanted to end with this quote from Michael J. Fox. And he said, people don't die of Parkinson's disease, they die with Parkinson's disease. And I thought that was a very good way to put it, because a lot of people people have misconceptions of people with Parkinson's disease. They think that, life is over once they have it, they can't function. But there are plenty of people functioning with PD. And one of the main reasons why they're functioning with PD is because they've implemented some kind of exercise program into their life to, like I said, and I will say it again, to try to maintain that normal body movement ability and function. So I thought this was a wonderful quote to end with. And here are my references. So in closing, Dr. Leiter, I really would have liked to have done this in person. I hope you enjoyed it. I hope the information was good. Once again, I thank you for everything that you've done, and I hope to stay in contact. And so that's it. That's all I have. Thank you, and we'll see you later.